All right, so again, these will be in the bucket that says K-Carts 2012 right there, okay? So again, you can pull this out anytime you want. Again, the overall heart, we got the apex, which is the tip of the heart. That's the easiest structure to do, okay? It's almost always on a practical, okay? Again, how do you tell front from back? You get this banner-like area right here in the front. It comes right across. That's the interventricular sulcus. In the back, it's almost straight up and down, okay? So again, if it comes at an angle, you're looking at the front of the heart. Plus, verify that because you look at the pulmonary trunk right out front. Can't see that in the back. Okay, now this one has the trachea, unfortunately, and stuff attached to it. Many hearts don't, okay? The other thing you see on the outside is that we have the interventricular sulcus. We also have the coronary sulcus. It's that fat area right here between the atria and the ventricles. Sulci are indentations. They get filled in with fat, okay? But that's where the coronary circulation is. The other thing you'll see here is a flap. Okay, that's called the auricle. It's an extension of the atrium. Okay, just like you have the auricle of your ear. There's a flap on the outside of your head. Okay, same thing. Then we're going to open it up. Again, we have a shiny covering right here, which we don't see the pericardial sac. Okay, that's gone. Okay, but we have the pericardium that's on the heart. It's also called the epicardium, which is this nice little shiny layer on the outside. When I open it up, the other layers are now evident. We have the myocardium, which is the muscle of the heart, and the shiny layer in the chambers is the endocardium. When you open up like this, it's disorientating, okay? Because depending on which one I give you, and people are like, well, what, is this right, left? Again, you have to have in your brain first what the structure of the heart look like to begin with. You know, here's left ventricle, left atria, right atria, what vessels come in and out of it, etc., okay? So I already have that in my brain. The next thing I do when I come in here is, okay, which is the left and right side? Again, we'll only look at one side at a time, okay? And look at the outer wall of the ventricle. See how this is thin and that's really thick? Okay, that's the left, this is the right. That's how you tell, okay? After you have that, then you go back to your brain diagram that you have, okay, and apply it to this, okay? So that's the left ventricle, this is the right ventricle. If I open this up a little bit, you see there's a chamber right here above these valves right here. See those little strings, okay, and flaps? So above the AV valves has to be the atrium, okay? So this is the right atrium, that's the left atrium, all right? The AV valves, okay, right here are atrioventricular valves. There are a couple of ways to name them. Okay, on the right side here, this is the tricuspid valve, or if you get stuck, the right AV valve is absolutely correct. Okay, there's no way to argue that. Okay, of course you're arguing with me, and I already just told you it's completely legal. Okay, this is the left AV valve. Okay, it's also known as the bicuspid or mitral valve. Okay, you guys need to know that if you're going in the health professions, because good old doctors, you know, still use the old terms. Okay, so you see that a lot. It's just shorter for you. The other thing you see here is the cordia tendineae. Only AV valves have those little tendons, okay, and they attach these lumps of muscle in the background. Those are the papillary muscles, okay. If you go down into a ventricle, if I could pull that open all the way so you can see it. See those like grooves down in there? Looks like a honeycomb, okay. See all those little grooves? Grooviness down in the bottom of the ventricle is a trabecula carne, okay. Grooviness up here in the atria, which is out here in the. Just grab this a second. Open that up a little bit. If I open up the auricle right there, if I get my stupid glove out of the way, okay, you see those grooviness over there on the side? Looks like a honeycomb, like a lattice work, right? That's called pectinate muscle, okay? So there's a lot of grooviness, baby. So the real 60s kind of heart, okay? I always do like my Austin Powers here. Groovy, baby, okay? All right, so after we do those, then we want to come up here for the vessels that leave the ventricles. And again, we're looking for vessels that leave the ventricle. So I come over here. This is the AV valve, so that's not the exit point. You see there's another exit point right here that I've cut through. This is the aorta, okay? And in the aorta, we have the semilunar valves, which are these little pocket things right here. And I'm pulling up on there, okay? So those are the aortic valves. See them right there? Now the pulmonary one is leaving back this way. It's going to the front of the heart, so I can't see it from this angle, so I flip it over. Sorry, wrong way, okay? And I cut it from the outside. I open the ventricle from the outside right up into the pulmonary trunk. So I could open it up, and this one's not cleaned out all the way. But you can see the valve right here that I'm pulling up on there. Okay, so that's the pulmonic valve. And if you put down pulmonic, semilunar, that's just more detailed answer, okay? But pulmonic valve is completely acceptable. Okay, and then the pulmonary trunk. From the atria, again, the left side's the easy side. So here's the left atria. If I find any vessel going out from that, there's one right there, okay, that's a pulmonary vein. That's the nice thing. Everything that comes into the left side is the pulmonary vein, okay? So again, that's how we'd usually have it pinned. We'd put a probe through like that, put a pin up on the probe or a tape or something like that, and say, okay, identify the pin valve. Find out what chamber you're in, and then think about your diagram, and then do it. Okay. The only one that's tricky is the right atrium because it has 3 different vessels, 2 very large ones, 1 small one, but they come at different orientations. Okay, so I've cut through one right here. You see there's a vein right here that I've cut through. I've opened it up. No valves. It's coming out of the right atrium, so that's coming from the top. That's the superior vena cava. The inferior vena cava, the heart sits like this in your body, and so it goes straight down. So if I go down like this, it should come out, yep, just like that. Tail's going downward. That's the inferior vena cava. The other one is the coronary sinus, which there is a small hole right alongside that. If I could put the probe in, there it goes. So here's my vena cava up here, but see the probe wiggling right there in that vessel that's on the heart? That's the coronary sinus. It's the largest vein of the coronary circulation. Okay, so that's how you're going to see that. Okay, I did the layers. Okay, the other things you have to do on the models. The ductus, well, it's not the ductus, it's the ligaments arteriosum between the aorta and the pulmonary trunk. You can only see on the models. I can feel the atrial septum right here, okay, and I can feel there's a thin spot with my finger, so you can verify it with your fingers, okay, but you'd see this on the model much better, okay. That's the fossa ovalis, okay, and the atrial septum is better on the models too, okay. And then this is the interventricular septum in between the two. That should be it, okay.